Atia Lemke. And she brings nurse practicing to a whole different level. It's not just walk in the door and have a blood test. This is a woman of compassion and strength, and she's willing and able and wanting to connect the dots for your best health, your wellness. So I would like to introduce you to her and have her tell you what her story is. Where did you get the idea that you needed to be this nurse practitioner? And then we have special guests who are your friends and your family.
Absolutely. Welcome to Olive Branch Wellness Center. It's been a lifelong dream of mine and a desire to be an extension of my community and to do a service in which I know will be in the best interest of my neighbors. I've been a nurse for about 22 years now. I worked in multiple different specialties. I worked in the ED, emergency room medicine, for about 13 years, and that was where I developed my passion for just learning more and more, especially with all of the different unknowns that come into the emergency room, just being able to think quick on my feet and to be able to do what is best in a matter of minutes for the best outcomes for the patient. So I encountered a patient who was a veteran who had been experiencing some mental as well as physical elements. And it was at that point I wanted to do more, but I was limited because of my role as a registered nurse. And so I was inspired by my God to further my education and to have the opportunity to be more impactful and more intentional for my patients so that they get the care that they need and deserve.
What would you say is the difference between being an RN and a nurse practitioner?
Yeah, so the difference is you have the ability to not only provide care, but you also can make decisions, help the patients to direct their care, to be a resource for them on a level that, you collaborate with other physicians. Your opinion and your input on the patient's care and their outcomes are, generally intertwined as well as they're incorporated into what happens to that overall patient. We're able to manage patients. I'm able to manage patients and develop relationship with them so that we can coordinate the care that they are comfortable with and that would also be what is in lines with best practices.
Who is your ideal patient?
So my ideal patient, I often, think about the patient that would be vulnerable, because then that gives me an opportunity to educate, to provide comfort, to provide up-to-date information, as well as to be empathetic with them and the needs that are specific to them. I like to look at my patients as individuals, so that whatever it is that they may need as an individual, we will work together to incorporate that in their care management.
That covers a wide berth of people. Somebody out there who suspects, oh, I've got a sore throat, or I really just don't feel right today. Is that somebody who should seek your care? Or is it also somebody who has more serious issues that are presenting?
Yeah, so definitely that person who is having, immediate, acute, minor acute conditions, cough, cold, flu. To me, and they're having more acute conditions that I'm not able to manage here, then we'll be able to coordinate that, and I'll be able to get them to the provider that they'll be able to receive the best care in their environment.
Well, how does this differ from an urgent care center?
So it's pretty much the same. We don't have radiology, so that's one of the differentiating factors. We have late hours, but we're not overnight. I'm not sure if some urgent cares they have an extended hours, but we are open late 2 nights a week. We're in a building that is handicap accessible. We have elevators. We have some of your generalized things that would be able to care for patients. So if there's something that's outside of my scope of practice or outside of my ability to manage here, then thank God we're not too far from some of the local hospitals.
Okay, so again, our wide swath of this woman, who is that patient?
That's anyone who's looking for a nurse practitioner who cares, who is someone who believes in education and empowering the patient to be able to be their best advocate as well.
So it borders a little bit on counseling too. I'm here.
Medical piece of things, but just looking at the whole patient and making sure that their mental, their physical, their spiritual, and their emotional well-being is under consideration and that is, well managed.
Right. Which comes under the umbrella of the medical pieces. So what are I think that's what I'm driving at. What are the kinds of medical pieces that you will be able to handle under Olive Branch's roof?
Yeah, so we have, I have the ability to diagnose, to treat patients with, like I said, minor, acute issues. If there's something that is immediately happening, someone has a sore throat and they're not sure if it's strep or if it's the flu or if it's just a virus, then we'll be able to evaluate them. We offer lab work if needed for further, testing. We can do that here. I will be able to prescribe as needed medications that will be able to treat, if there is a condition that. Yes.
It's very nice, and just your demeanor is just so polished and lovely. How does that play a role here?
Yeah, so that will be something that we'll be offering a service, IV hydration. So we'll be able to help the patient who has, maybe have some energy depleted, may have, some immune compromise. They're looking to boost their immunity. Patients that are athletic that just may need a little bit of extra hydration for those days and those events where they're kind of wiped out due to sporting. So we're definitely looking to offer patients an opportunity to address their immune system as well as their hydration status, because that is definitely very important for your overall health and well-being.
Of course. And that person who just has the sniffles and wants to feel better immediately, there's somebody who should call you, right?
They definitely should call me. They should definitely call me. And I am looking and excited to serve the community of Franklin and beyond. This is just a great time for me. I'm getting to do something that I'm very passionate about, that I love, that I couldn't see myself doing anything else. And I'm excited. I'm excited to serve you, Franklin.
Oh, it's just lovely. And you could see excitement.
Sister Monique, I'm so excited that she came to support me. She's also a nurse, and she is soon to be also a nurse practitioner.
Wow.
So I'm just looking at, all the things that she's doing right now and excited for her and her future as a nurse practitioner as well. So,
Well, in chatting before, you did say that Atia was your inspiration.
Yes. So Tia has inspired me to become a nurse from the beginning. I graduated LPN school in 2009, and I'm continuing now and soon to become a nurse practitioner as well. She's a continued inspiration. I'm so proud of her, and so I came here today to support her.
How do you think she inspired you the most?
She guided me because I wanted to be multiple things as a kid. Like I wanted to be a doctor, a nurse, a teacher, like ballerina. Yes. So she basically helped me determine which would be what career path would be better for me. And I love to help people. And so she said, "Have you ever considered nursing?" She actually drove me down to the college and introduced me to people. And so from there on, I was able to get to this point that I am now. And I tell her a lot that I greatly appreciate her. Like, she was meant to be in my path.
That's so lovely, and that's how it starts, Franklin. That's how pathways and connections are met, and that's how trust is built. It's a beautiful story, really. And now, who are the rest of your team?
So this right here has been my best friend since ninth grade. We had similar backgrounds. We moved here from East Orange. That's where I'm originally from. We had no encounter, or we had no knowledge of each other prior, but when we joined the
Journey.
my journey.
Journey, as you said. You watch people build their dreams, and when they come true, it's just amazing to see her flourish.
Well, what I'm seeing, not only with your testimony and Atia's testimony, not her
So for those families who are to care for them.
Somehow I knew that.
So we'll have to, come up.
Well, I think you're going to have a glowing future here at Franklin. We're already so proud of you. So, and we thank your phone for the beautiful background music. Actually, very lovely and soothing.